Welcome to this explainer. Today we've got something really fascinating and honestly incredibly practical lined up for you. We're going to decode this very specific, kind of mysterious little digital memo. It's literally just titled Say Memo, which translates to New Memo. And, on the surface, it looks like your basic everyday notepad entry. But as we unpack the links hidden inside it, we're actually going to reveal a vital roadmap for health and physical safety. This memo brilliantly connects the dots between specific eye conditions and a massive public health concern, fall prevention. So if you, or maybe an older adult you care for, are navigating the challenges of aging, this is an absolutely crucial decoding of authoritative health info. Let's get into it. Okay, let's dive into this. What exactly connects eye health to physical safety? I mean, it sounds like a totally simple question, right? But the source material we're looking at today suggests a much deeper, way more complex relationship. We aren't just talking about, needing a slightly stronger prescription for your reading glasses. No, we're talking about how specific, sometimes super sudden, and highly disruptive eye conditions literally compromise our ability to safely interact with our physical environment. Think about it like a data stream. When the data stream from our eyes to our brain gets corrupted, the physical risk of falling just absolutely skyrockets. So here's our path forward today. First, we'll unpack the actual structure of this health memo. Then, we're going to look at the specific conditions it highlights: visual snow syndrome, navigating low vision, and those really critical warning signs for retinal detachment. And finally, we'll tie the whole shebang together with the CDC's fall prevention strategies.
Section 1. Unpacking the health memo. The source material.
Now, Say Memo is just a digital list. At a passing glance, you'd probably think it's a completely disjointed collection of saved bookmarks. But when we actually look at the specific embedded links in their labels, this highly intentional pattern emerges. This memo contains exactly 4 links, and they point to the absolute highest medical authorities: the American Academy of Ophthalmology, the Centers for Disease Control and Prevention, the National Eye Institute, and the Mayo Clinic. The author of this memo wasn't just casually browsing the web, right? They were mapping out a critical pathway. They drew a direct, straight line from specialized ophthalmology guidance right into physical safety protocols for older adults. It's essentially a curated guide for caretakers and patients alike.
Section 2. Visual Snow Syndrome. Guided by the American Academy of Ophthalmology. The very first link in our source memo directs us to the official guidance on visual snow syndrome from the AAO. Now, to understand this, imagine looking at the world through the static of a badly tuned old-school television set. That is the disruptive reality of this condition, and this really brilliantly illustrates our first major cause in the vision-to-fall pipeline. The memo deliberately points to the AAO's breakdown of symptoms and treatments to highlight how this continuous visual disturbance fundamentally messes with a person's ability to safely view their environment. I mean, if the floor you're walking on looks like a field of static, your risk of a misstep and, a subsequent fall is dangerously elevated.
Moving right along to Section 3, Navigating Low Vision, Resources from the National Eye Institute. The memo then points us to the National Eye Institute to address low vision. Now, what's really interesting about this slide is the shift in perspective. Low vision isn't necessarily a sudden static overlay like we just talked about. Rather, it represents a broader, chronic, and ongoing visual challenge. The NEI provides comprehensive eye health info specifically for conditions that just cannot be completely corrected with standard glasses, contacts, or even surgery. When your visual acuity drops to this level, it fundamentally changes how you navigate space. Your contrast sensitivity decreases, which makes it incredibly difficult to, say, distinguish the edge of a step from the floor below it. It's a persistent daily hazard, and it requires constant adaptation.
Section 4. Retinal Detachment Warning Signs. Guidance from the Mayo Clinic.
Here, we're contrasting 2 very distinct types of visual threats highlighted in the memo. On one hand, we've got the chronic, ongoing reality of low vision from the NEI that we literally just discussed. But on the other hand, the memo links directly to the Mayo Clinic's guidance on the warning symptoms of retinal detachment. And wow, this is a severe acute eye emergency. We're talking about sudden flashes of light, maybe a sudden influx of floaters, or, and this is scary, a literal dark curtain falling over your field of vision. The memo places this acute emergency right alongside those chronic conditions to ensure we categorize these distinct visual threats properly. One requires daily management, the other? Well, that requires an immediate trip to the emergency room before a catastrophic loss of vision and a likely catastrophic physical fall actually happens. Let's move on and see how this all builds into our final macroscopic view.
Section 5. CDC Fall Prevention Strategies, the STEADY Initiative.
This is where the tension of those frightening eye conditions finds a proactive release. The final link in Say Memo directs us to the CDC's STADI initiative. STADI stands for Stopping Elderly Accidents, Deaths, and Injuries. It provides incredibly empowering, highly researched fall prevention guidance that is specifically focused on older adult safety. Honestly, the genius of the memo's author is placing this link right alongside all those ophthalmology resources. It forces us to shift our focus from the micro, the specific structural failures of the eye, to the macro consequence of keeping our bodies safe as we move through the physical world.
So the crucial point is this specific operational protocol right here. The source material isn't just giving us reading assignments, right? It's giving us a clear sequence of action. Step 1 is the recognition of visual threats. You monitor visual symptoms using the authoritative guidance from the AAO, the NEI, and the Mayo Clinic. You watch for the static of visual snow, the blur of low vision, and those sudden warning signs of retinal detachment. Then Step 2 translates that awareness directly into actionable physical safeguards by implementing the CDC's steady fall prevention guidance. You remove tripping hazards, you improve the home lighting, and maybe you adjust medications. And all of this is heavily informed by the visual baseline established in Step 1.
If there is one overarching synthesis to take away from our explainer today, it is absolutely this. Protecting our vision is the very first step in protecting our bodies from falls. Say Memo might just be a tiny digital document, but it brilliantly intertwines these two disciplines. The ophthalmology links aren't just about saving your eyesight. They are functionally the early warning system for the CDC's physical safety protocols. By understanding our visual limitations and emergencies, we can proactively redesign our physical routines to prevent devastating falls.
And that brings us to a final, pretty provocative question I want to leave you with today. Are you actively monitoring these visual warning signs to prevent future falls in your own home? Whether it's for yourself or an older adult you care for, are you really utilizing these authoritative resources to their full potential? The links from the AAO, the NEI, the Mayo Clinic, and the CDC are out there, and they're readily available. The roadmap exists. It's really up to us to follow it, keep our eyes open to the warning signs, and keep our footing secure. Thank you so much for joining me to decode this critical information. Stay safe, stay curious, and keep learning.